Welcome to the Regen Doc Podcast, powered by dynamicathlete.com. I'm your host, Dr. Aneesh Garg. I'm Yale trained, Andrews trained, and a two-sport U.S. national team doctor here to help you make sense of regenerative medicine. PT for 6 months and nothing changed. Now what? You did everything right. You showed up to PT 3 times a week. You did your home exercises. You iced. You rested it. 6 months later, you're sitting in your car after your last appointment wondering if this is just what your life is now. Here's what I want to tell you. PT not working isn't a failure on your part. It might mean that there's a structural problem and exercises alone won't fix it. And there are other options that you haven't tried that you might benefit from. We're going to get into that.
So a couple of questions about what you just said. Let's start with the first one. I've done everything my PT told me to do. I'm not lazy. I showed up. Why am I still in pain?
It's a good question. PT's brilliant at rehab and strengthening. So let me get that out off the gate. I think PT is super important. When we were talking about this in fellowship, Dr. Andrews would talk about and say, the work you do is 50%. The work you do afterward in PT is 50%. So even if you're doing surgery or you're doing procedures, a lot of that success is going to come from PT as well, post. The difference we have in regenerative medicine, we do a lot of things pre-treatment that can make a difference. But when we're talking about physical therapy, I think it's a huge, huge benefit to doing it. But if the tissue's damaged, PT can't fix that. If there's a structural problem, physical therapy is going to have a difficult time overcoming that. So then you're trying to build a house with a broken foundation. So no matter how much you do these exercises, no matter how many home exercise programs you do, and you're not getting better, that's the challenge. This isn't an effort problem. I often talk about this with our patients. There's usually 4 reasons why somebody's not getting better. I talk about 1, either you're not working hard enough. I say that to the patient or the athlete. 2, your PT isn't pushing you hard enough. 3, either I missed something, or 4, something's changed. It's usually one of those 4. And it can be either one. But the big thing here is that if PT is not working, it's not usually an effort problem unless it is, right? Unless you're just not working hard enough, or you're not getting pushed hard enough, or there's not a really good understanding. And I think that's where sometimes that fails.
How long should I keep doing PT before I know it's not going to work? When is enough enough?
That's a really good question that I tell my PT colleagues. The quick and dirty of it is 4 to 6 weeks. I tell my PT colleagues, look, you got 4 to 6 weeks with them. That's it. If they're not getting better in 4 to 6 weeks and you're not seeing tangible difference, I think there's a time where we need to look at something different. If they're having continual challenges with getting better, and I know there's a lot of places that'll say, look, they need to come 3 times a week for the next 3 months. I think there's ways that we might be able to help in our clinic, certainly, where we can get them back quicker. I think 6 weeks is a really good marker. And I think you should be able to tell really somewhere between that 3 to 6 week mark whether or not they're getting better or they're not. So if you're in PT longer than 6 weeks, I would tell you to potentially go get another opinion. And it has nothing to do with the quality of the PT standpoint. It's just if you keep doing this, those 6 weeks turn into 6 months. Those 6 months turn into a year. That year turns into 5 years, 6 years, 10 years, a decade. And then what are we doing? And I think that's really the big thing. So that's information for us, not failure. I don't see it as failure. I go, this is something that we've sort of checked off and said, okay, we tried physical therapy. It hasn't gotten to me where I need to get to. How do I do differently now? Right. And that's where Is it something from a regenerative medicine standpoint? Is it something from an imaging standpoint? And a lot of times I tell my physical therapy colleagues, if you're ordering an MRI, which in Colorado, apparently, I didn't know this, but physical therapists can order MRIs. When I was in Chicago and Nashville, that wasn't the case. And so I think one of the other things too, just from a physical therapy standpoint, that if you're getting an MRI from a physical therapist or an ultrasound, say, from a physical therapist, just make sure they have a really good background in it and they know what they're doing, because just ordering the imaging isn't good enough. I can't tell you how many times I've looked at the MRIs or I've looked at imaging and I've had a different call than what the report said. And I think the advantage for me is that I have the patient right in front of me and I can correlate the MRI with the patient in front of me, which is way easier than what the radiologist has to do. So I think there's a distinct advantage for me to be able to look at the imaging, but that's the trick of this. You have to look at your own imaging. And I think if somebody's not looking at the images and going over with you, then I think you need another opinion. So to answer your question, 4 to 6 weeks on how long it is, and then it should be continual. It should be continual reassessment and reevaluation. That's why in our office, when we see people coming in, we're always checking. Are you getting better? Are you not getting better? Why are you not getting better? Why? What happened here? It is a constant reevaluation. And so even when we're doing our treatment protocols, that's part of the process here. So I think that's really the big key is, are we making progress or are we not? And I think that's something that people should certainly keep in mind when they're going to physical therapy. Are we making progress? Are we making progress or are we not making progress? Right? And I think if anything, this is really good time that if any of this resonates with you, I would tell you to go visit dynamicathlete.com and read up on some of these things that can actually accelerate your healing and can be a really good augment to your physical therapy program and help you recover faster. So if you hear something that is, and you're like, that makes a lot of sense, go to dynamicathlete.com and see and read up about it and ask your physical therapist, hey, I read up about these. What do you know about these?
You mentioned constant reevaluation. Tell me about someone who hit the PT wall and thought they were out of options. What did you find that everyone else missed?
Yeah, I think it's more about the value of having another pair of eyes on something and looking at things from a different lens. I think that's super important. And so I'll give you an example from last night. So a good friend of ours had shoulder pain for going on for months, and they were doing exercises. They couldn't figure it out. And it was all their pain was in their anterior shoulder, the front of their shoulder. And they've been having issues, couldn't figure it out. And then they started to get frozen shoulder, right? We call it adhesive capsulitis, frozen shoulder. Couldn't figure out what it was. They thought it was a rotator cuff issue. They thought it was a biceps issue. And then we started looking into it, and it was actually a posterior capsule issue. So imagine somebody's going into physical therapy, working on this and saying, this is where I hurt, this is where I hurt, this is where I hurt. And they keep working on the same things, but then it doesn't lead to any change. And now he's 3 months into it. And we just did a little bit of work and focused on a different area. And he's much better. A lot of times in frozen shoulder, people neglect the posterior capsule. And I can't tell you how many times that gets missed. And so we started doing a little bit of work, and I said, when's the last time you were able to move your shoulder like this? And he said, I don't know, months. And so that's kind of what I get at about the 4 to 6 week mark, that we have the ability to buy back time with some of the regenerative medicine things that we're doing. And so imagine if we got this guy back 6 weeks ago. It would have been 6 weeks of him not having to deal with this pain, not having interrupted sleep because he's waking up because his shoulder's in pain. So think about this in terms of what's your most valuable asset? It's your time. So if you're toiling away in physical therapy for weeks and months, years, you're just giving away time here. And there's faster ways to get better.
What if my PT said, if this doesn't work, the next step is surgery? Are those really my only two options?
Well, this is where I tell you, go get a second opinion. Maybe you need to change PTs. I mean, I think if that's what your options are, then your physical therapist is stuck in the old paradigm. PT, steroid injection, surgery. If that's the lane that you're in, then I would tell you to go get another opinion somewhere. I don't think they're just up to date on some of the things that are out there, right? And so if these are the only two options presented, I'm here to tell you, this is the whole reason this podcast exists. We've had people that have asked us to do this podcast because they said the things that you say in the office, people should know about, because the only thing that they know is physical therapy and surgery. And if you want to add the third steroid shot, fine. But they said people need to know about this. So the title of the podcast, I've tried PT for 6 months, or this episode, I've tried PT for 6 months and nothing's changed. Now what? And the surgery is not the answer here, right? So I think that's the challenge. And now you're going to go to your PT and say, well, wait a minute. I heard from the Regen doc, powered by dynamicathlete.com, that here are my other options, right? And if we can talk about that, not only am I going to avoid surgery, not only am I going to avoid pain medication, but I'm actually going to get better faster. It's a pretty good deal, right? And so I would encourage you to really look at these options and talk about what fits and what works for you. So I think that's a really big thing. Again, if PT fails, quote unquote, after the 4 to 6 weeks, I don't look at this as a bad thing. I think it's information gathering. So we know that if your physical therapist did what they're supposed to do, and you worked hard enough and you did what you were supposed to do, that gives us information. You need to do something different and then potentially go back to therapy and get stronger once that's been corrected. So just because you failed physical therapy doesn't mean physical therapy doesn't work. I think it's the same thing with anything, that just because it didn't work in this moment doesn't mean it can't work for your issue. We just have to do something different. And that's really one of the big things. So that's more of a systemic problem. So this isn't on anybody in that regard where I'm casting blame on somebody. It's just more of a systemic problem, right? If your goal is to just do whatever insurance tells you to do, I'm here to tell you insurance isn't looking out for your best interest. And there's a lot of people that will talk about this. It's a systemic failure. So if you're going to only go where insurance is covering things and you're going to let insurance companies dictate what is being done for you, then you're going to have limited options. You're going to go to the physical therapist because insurance covers it. I'm going to go to a doctor and go get a steroid injection because insurance covers it. If that doesn't work, I'm going to go get surgery because insurance covers it. So I think there's a cost with everything. There's opportunity cost, there's time cost, there's a lot of other things. So just because insurance covers it, quote unquote, and nowadays with people with very large deductibles, how much of it's really actually covered by insurance? So you could spend the same amount of money with the high deductible and get that surgery with all the ramifications that come with surgery and then not be better off. 44% of people that have surgery still have pain afterward. That's not my statistic. That's not me just making it up. I mean, this is out there in terms of what the percentages are. So now you've got a 56% chance of having no pain after surgery. Just a little bit better than flipping a coin, right? We talk about our outcomes in our office. Over 90% of our patients in our office are at least 75% better by their own admission post what our treatment protocols are. That's a monster number. And I mean, that's self-reported. I get it. I mean, we'll get people say, oh, well, that's not a real statistic. It's self-reported. I'm just telling you how we gauge things in our office. But that's an over 90% clip. That's a monster number to put up. And so, and all of that is without surgery. All of that's without pain medications. And so if that's something that is appealing to you, then I would encourage you to check out what we're talking about here. So that's really the big thing in terms of where it's not a PT problem, it's more of a systemic problem in that capacity.
Okay. My last question, what's your message to the PTs and docs out there who keep pushing the same plan for 6 months with no progress?
What are we doing? If you guys listen to this podcast long enough, I think you're going to hear, what are we doing? Maybe more than you care to hear, but it's the truth. We keep going through even in our clinic and I say, like, what are we doing? If this isn't working, what are we doing? So if you're going to a PT and that's all they're doing and you're not seeing any progress, walk out. Because to me, that's a lazy, convenient way for them to take care of you. What we do in our office is not easy. It's challenging because it's so patient centric. We're trying to get you back as soon as possible, in the best way possible, in the safest way possible. And that takes a lot of, again, reevaluation, making sure we're on the right path. If we're not, do we deviate? Are we sure we're on the right spot? Do we need to do something different? I mean, there's a lot of things that go into it. And so that's why I think we get the success that we end up getting. So your question about what do I tell them? I say there's better options out there. And I think you have to be willing to expand what your options are if you're not getting the results that you want. If you're satisfied with 6 months of people not having any progress, then I question whether or not you're actually looking out for the best interest. And that's, at the end of the day, that's what we have to do here. So I think that's really the big piece in any of that regard. So if any of this stuff resonates with you, I encourage you to go to dynamicathlete.com, check that out, read about the things we have on our website, or I encourage you to check those out, read about the things that are on the website, and make an informed decision. The whole goal of this is for you to be more informed wherever you go. So if this resonates, this is exactly what we do at Dynamic Athlete. Go visit dynamicathlete.com, educate yourself about it, and then we'll see you next time.